So we mark World TB Day this year against the backdrop of ongoing coronavirus pandemic and, of course, the war in Ukraine, both of which are having devastating impact on health systems and preventing people from getting the care they need. The TB burden remains highest in low middle income countries, but in Eastern Europe, it's also a major concern. Russia, Ukraine, Belarus are among the countries with the highest rates of drug resistant TB in the world. Globally, with the exception of only COVID-19, TB continues to kill more people than any other infectious disease. The first UN high-level meeting on TB was held in Moscow in 2018, when political commitments were made to end this disease, including early diagnosis of TB, universal drug susceptibility testing, and finally systematic screening of contacts and high-risk groups. For many reasons, progress is stalling on these three key indicators. Recognizing that we are still over $10 billion short of the funding needs to achieve the test, treatment, and vaccine targets, this year's World TB Day theme is Invest to End TB to Save Lives. Continued lack of investments means that we still do not have the tools we need to diagnose the disease in children or to screen individuals in at-risk communities. But as well as money to spur innovation, we must also invest our time. Time to engage with the communities, time to keep TB high on the political agendas. And if we do not invest in infectious diseases like TB and COVID, they flourish. And they flourish in the face of disrupted health services, especially when people are displaced and highly vulnerable. The diseases are our common enemy. And to me, the most powerful argument for investing in TB right now is to build on the unprecedented momentum in technology innovation, not just for diagnostics, but also for vaccines and drugs that's coming through COVID. Never before, and perhaps never again in this century, has the bar been lower for the return of the investments. Today, we can take the best COVID innovations back to the big infectious disease killers like TB. The pandemic will hopefully soon come to an end, but also will this unique investment opportunity in TB. Therefore, today we call on the world to invest to end TB to save lives. Thank you.